Today, let's talk about effect of beta blockers and exercise restriction on the prevention of sudden cardiac death in pediatric hypertrophic cardiomyopathy. Risk assessment tools and effective prevention strategies for sudden cardiac death in pediatric patients with hypertrophic cardiomyopathy have not been established. This study aimed to evaluate the efficacy of beta blockers and exercise restrictions for sudden cardiac death prevention in this population. Coming to the methods, the medical records of patients aged less than 18 years who were diagnosed with HCM at the center between January 1996 and December 2021 were reviewed retrospectively. Sudden cardiac death and aborted sudden cardiac death were defined as sudden cardiac death equivalents. The patients were divided based on whether they were prescribed beta blockers or exercise restriction and compared the outcomes among the groups. The primary outcome was the overall survival, and the secondary outcome was the cumulative sudden cardiac death equivalent rate. Outcomes were analyzed using Kaplan-Meier curves and Cox proportional hazard analysis. They also compared patients according to the occurrence of sudden cardiac death equivalents to identify sudden cardiac death risk predictors. Coming to the results, among the 43 included patients, sudden cardiac death equivalents occurred in 13 patients over 11.2 years of follow-up, among whom 12 were resuscitated and 1 died. The OS rate was significantly higher in the beta blocker and exercise restriction groups that in the overall survival rate was significantly higher in the beta blocker and exercise restriction groups than in the non-beta blocker and non-exercise restriction groups. Among the 13 patients with sudden cardiac death equivalents, 5 had 9 recurrent sudden cardiac death equivalents. A significant difference was observed between the SCD equivalent and the non-SCD equivalent groups in the history of suspected arrhythmogenic syncope in the unvariable but not in the multivariable analysis. To conclude, beta blockers and exercise restriction may decrease the risk of sudden cardiac death in pediatric patients with hypertrophic cardiomyopathy and should be considered for sudden cardiac death prevention in this population, particularly because predicting sudden cardiac death in these patients remains challenging.